At the height and in the beginning of the pandemic, we just didn't have enough staff to respond to the magnitude of the pandemic. So what we have done in the course of responding to this pandemic is to engage our MRCs, our Medical Reserve Corps, and hire 2 dedicated staff to just our congregate settings, which are our high-risk facilities. Evanston has a population of 75,000 and is rich in long-term care facilities and congregate homes. We have in excess of 20 of them. So that shows you that the magnitude of work that had to be put in order to lessen disease burden.
I think the biggest impact that we've had has been able just to provide that direct support at the clinical level. In the beginning, there was just such a need to really teach these fundamental principles of infection control, quarantine and isolation, and being able to train facility staff to be able to implement this in their facilities from the top down, because infection control, everybody has to be on board, all the way from directors of nursing, RNs on the floor, CNAs, dining staff. You had to have everybody on board to do their part in order to really mitigate outbreaks.
I think it's come to the forefront now with COVID-19, where most people do not know what the health or public health does. So in my explanation to individuals, I'll say disease investigation and surveillance is part of what we do. And now they kind of understand it. I think we have gotten closer to the administrators of these facilities. They know who to call, they know who to email to get a quick response. And that has been great for us in this response. They don't have MRCs already to look at that angle. Some of the volunteers are through maybe the fire department to look through that angle too, because we've had volunteers through SEARCH, which is an emergency response team organized by our fire department, help in our vaccination efforts and other volunteering opportunities.
I think another salient point would be just having the ability to build your data sets. We had to build our own data systems to track what was happening at the local level. And, that's important epidemiologically, but also just for infection control purposes, where I had to build out on my own as well, where the larger the facility, the more I knew I had to know their census. I had to know what their numbers were, admissions, discharges, because at any one point in time at the height of the pandemic, I was requesting, I couldn't make it a requirement, I was requesting, I need you to keep 20% of your capacity open in case you get an outbreak. We knew what this was the potential this had to build out to, and asking facilities to set aside empty rooms to make a COVID unit when no one was really doing that. And then, okay, well, how do we do this? Well, how do we make an isolation room when we can't get these supplies? Home Depot, get the tape till you can get your Visqueen in here. This is what you're going to do. Repurposing, things like that. So I feel like in the future, just being ready for potential scenarios of this magnitude to be able to respond and have that ability to pivot.
I think the health department should look along those angles to also assist their long-term care facilities through PPE provision and any other supplies that are needed. We were able to supply the PPE, other supplies, sanitizers, disinfectants, when there was a shortage. And I think that has helped the lessening of the transmission rates in our long-term care facility, because they were able to obtain these supplies from the health department.
The ability to connect our long-term care facilities and congregate care facilities with each other, that was also integral. At one point in time, antigen testing was difficult to obtain. And when the federal allotment came out, Some facilities had tests, they just didn't have the capacity to use all of them. So we created a facility share with approval so that we were able to connect facilities that weren't using their antigen tests to share them with the facility that maybe in an outbreak and needed those tests, building these networks locally so that even after the pandemic, these relationships still exist for them to assist each other.